Hi, my name is Jack Engel.
And I'm Victor Ogden.
We are here to elucidate the detrimental effects of radiation therapy on the recipient's hearts and the heart's functions.
To encapsulate the dangers of radiation therapy, we first need to go into about what radiation therapy is.
The most widely used form of radiotherapy, external beam radiation, is used to treat a wide variety of local cancers.
It is administered through either a photon laser or a proton laser. This process kills the malignant cells, but in the process, it can kill other healthy cells.
During the procedure, the laser is aimed at the tumor, and the radiation kills the cancerous cells by damaging its DNA or creating free radicals that can affect the tissues.
As said previously, radiotherapy can also kill healthy cells, making the treatment a potentially dangerous process. This can alter the DNA replication in healthy cells, so it can lead to side effects.
In our meta-analysis, we have taken into account two different studies of the effects of radiotherapy. One study focuses on the treatment of female breast cancer patients, while the other study focuses on Hodgkin's lymphoma patients, both male and female.
Each disease has a different dosage for radiation for treatment. In breast cancer, most patients are treated with 100 to 500 centigrade being the measure for radiation. However, Hodgkin's patients are normally treated with a dosage of 2,000 to 3,000 centigrade.
One of the biggest detrimental side effects to the loss in cell function caused by radiotherapy is ischemic heart disease, also known as coronary heart disease.
Ischemic heart disease, a chronic disease that can be lifelong, triggers a buildup of plaque in your coronary arteries, restricting blood flow to the organs in your body.
This can lead to chest pain, heartburn, nausea, vomiting, shortness of breath, sweating, or even fatally, heart attacks.
Overall, ischemic heart disease is extremely fatal, as it can commonly cause heart attacks in the victim.
Valvular heart disease is a condition where any of the four valves in the heart, the aortic, mitral, tricuspid, and pulmonary, deteriorate and either leak or become narrowed. The two most common valves affected are the aortic and mitral valves.
This can lead to an excess amount of blood pooling in your lungs, making it hard to breathe, and can cause the fusing of valvular flaps.
This illness can and will cause death in a number of different ways.
A study that we performed meta-analysis on was an examination on the effects of radiotherapy on breast cancer patients. The study consisted of the analysis of a number of medical records and autopsies.
The study population consisted of 2,168 women, all with breast cancer, living in Sweden and Denmark. All patients were under the age of 70 at the time of diagnosis. 963 of the patients had major coronary heart events, while the remaining 1,205 acted as a control for the remainder of the experiment.
All of the patients had no prior history of major coronary events before the diagnosis of breast cancer.
The average dosage of radiation administered to each patient rounded out to about 490 centigrade, while the range of dosages was 3 to 2,772 centigrade.
Other than the fact that women with a tumor developed in the left breast created a larger chance of coronary events than the development of the tumor in the right breast, there is no difference in the risk for coronary heart events created by the location or formation of the tumor.
The risk of coronary heart events increased proportionally to the dosages of radiation administered to the patient. Every 100 centigrade, the risk of coronary heart events was raised by 7.4%. However, when measured in 4-year increments, one would find that the increase in the risk of major coronary heart events continually went down.
The risk of a major coronary heart event was increased if the patient was an active smoker, had a history of diabetes, circulatory diseases, chronic obstructive pulmonary diseases, or was obese.
Among the major coronary events, 44% occurred within 10 years after the administration of radiotherapy. 33% occurred between 10 and 19 years after the administration, and 23% occurred 20 plus years after administration.
As a result, a total of 54% of the case patients perished from ischemic heart disease.
The 15-year mortality rate differed greatly from tumors formed within either breast. The 15-year mortality rate for patients with a tumor formed in the left breast was 13.1%, while that of patients with tumors in the right breast was 10.2%, due to the radiation being applied to an area closer to the vital vascular organ.
These effects are diminutive compared to that of Hodgkin's lymphoma patients who were treated with radiotherapy. Due to a greater average dosage to patients, the radiotherapy took a higher toll on the patients, causing an immensely higher risk for valvular heart disease.
The patients included in the study were 1,852 5-year survivors of Hodgkin's lymphoma, or HL, who had been treated with radiotherapy. The time of diagnosis for our study population was between the ages of 15 and 41.
None of the patients had any malignancies prior to their HL diagnosis, except for non-melanoma skin cancer or carcinoma located in the breast or cervix. This could have led to discrepancies in the data.
For each patient that had valvular heart disease, 3 control patients were chosen based on similarities defined in sex, age, time of diagnosis, etc. However, some control patients served as just that for more than one case patient.
The average dosage of the radiotherapy administered to the patients was 3,700 centigrade, and the control patients received an average of 3,017 centigrade, greatly differing from that of the first study that we analyzed.
The increase in valvular heart disease risk was non-linear in relation to radiation administered. The rate for valvular heart disease was increased by 2.5%, 6.5%, 11.2%, and 24.3% when the centigrade dosages were 30 or less, 31 through 35, 36 through 40, and more than 40, respectively.
A possible factor that could have changed the results is whether or not the patients had hypertension.
This study highlights the risk factors that are a result of radiation therapy applied to the heart valves. Due to a high average dosage, the patients were at higher risk for valvular heart disease and other coronary diseases such as ischemic heart disease.
What we can take from these 2 studies can be instrumental in understanding the risks of radiation therapy. Radiation therapy affects all cells rather than solely malignant ones. Consequently, radiation therapy can lead to a number of lethal cardiac diseases.
Radiation therapy applied to the chest can have several detrimental effects to the heart and can even lead to ischemic heart disease, a stone-cold killer, and valvular heart disease, his sidekick.
This has been Victor Ogden
And Jack Engel.
on Radiotherapy News on Channel 42.0.
Good night.